know anything about how their body works. I mean, nothing. That's a perfect example. You know, I would ask people, okay, guys, you know the answer because you've heard me talk about this, but it's probably the most easiest question. Is high blood pressure good or bad? Huh?
Good and bad.
Good or bad? No, if you know the answer, you know, this, the old ones don't say it. New ones. Okay. Is high blood pressure good or bad?
Well, we're all talking about.
Okay. Why?
I don't know.
Okay. All right. Now, if people knew how the body worked, you know, it's good and bad. Now think of it this way. You know, you work at Walmart. Okay, you're 18, let's say. Okay, you work at Walmart. Okay. You get off at 12 o'clock at Walmart because it closes at 12. You don't have anymore. Okay. You go to the parking lot. You're all by yourself. You turn on. You try to start your car. It doesn't start. So you get a little frustrated. Okay. All of a sudden, 5 big dudes are coming to your car. What happens to your breathing?
Rapid.
What happens to your pulse? Incorrect. What happens to your blood pressure?
Right.
Why?
Flight and fight.
Okay, so the question again is, high blood pressure, good or bad? See, high blood pressure is adaptative. So say, for instance, you go to your doctor, okay, and he says, you know, John, your blood pressure is high. You know, it's a little high, I'm concerned. I'm going to give you some medication. So you get the medication, you come back in a week or 2 weeks, or a month, doesn't really matter. And he says, hey, it's perfect. But here's the problem with it, okay? And here's the problem with it with medication. Your blood pressure went up for what?
For a reason.
For a reason, adaptation. You take the medication, it brings it down. Here's the problem, okay? The body still thinks it's in the parking lot. Because you have done nothing to change what's going on. All you've done is take the reading and basically lowered it. You haven't done anything. So it's a normal adaptation to what the body's supposed to do. But people don't think about it. Because, you know, a lot of you have children, some don't, okay. But when you have a fever, what's the first thing people want to do?
Lower it, you know, flow through.
And why do they want to lower it? What's the fever for?
Fight the infection.
Right. And what do people do? They lower it. So not only are you making it last longer or making the body work harder, okay, but you're bringing the inefficiency of how the body works. And the body's like that. It's so simple that people forget. You know, they forget what it's there was for. Now the reason we brought it here is everyone here, okay, you know, comes in for a pain. Okay. So the question is pain good or bad?
Both.
Yeah, it is both. Okay, what's it for?
You tell us something.
Okay, how does it do it? But here's the problem with pain, okay? It isn't a problem when people come into the office with pain, okay? Is pain the first part of the problem, or is it the last part of the problem?
The last.
Huh?
The
It's
last.
Okay. See, people don't know that. So if you have, I have a couple of 20-years-old today. 20 years old come in really bad pain. I mean, I don't know. Actually, I had 3 today. I mean, 3 new patients. All young kids with severe pains in their neck and their back. I mean, how is that possible? I mean, 20, 30. So, for instance, when was the first time you ever had back pain? First time. You're what, 41 now?
I'm 46.
46.
I was probably 20.
20, okay. Now, based on that, when did the problem probably start?
Oh,
Unless
probably.
you were in a car accident like that.
Actually, yeah, lifting boxes just too heavy.
Okay, so that's the first time you felt it.
Mm-hmm.
And how many times have you lifted boxes like that?
Oh, millions of times probably.
Yeah, so it started accumulating. So things happen and you don't know it. Okay, and there's really no way of knowing it. You know, it's one thing. I'm not sure women should be lifting heavy boxes. Actually, they shouldn't. You know, times have changed. Times have changed. I had some women here actually mad. Had one here the other day. She had to do these things, and she was upset because, you know, she had a half of guys because they didn't know anything, but she had all the knowledge, and she had to do all the lifting. She injured her back. You know, sign of a time. You get some more food?
Okay.
Yeah. So you know, what happens? What do we do? How does the body work? How does it function? The body is so simple, you know, that it goes beyond comprehension. You know, and that's the part. You know, you can see it every day with people, but you don't really think about it. You know, it's like you go to the grocery store, you know, on a Saturday, and you know, watch the blue hair ladies. You know, and they walk around like this. You know, and I look at them and I go, God, you know, why didn't you go to a chiropractor? You know, why didn't you do it? But they have no idea what it is that you have a chiropractor. My mother-in-law, some of you know her, some of you don't. When I met my mother-in-law, I think she was 50. She worked for me. She's the one that started working for me. And she's 88 now, I can tell because she's in here. Okay, and she still works for me, by the way. And she does my books. And when I met my mother-in-law, she was like this. Okay. Now she's 88 years old, and she's still like this. But the beautiful thing about it, I knew her mother, okay, and her mother was like this.
Wow.
No, I'm serious. That was her mother.
Wow.
Now, Yvonne, a few years ago, I think it was last year, had a bone mass. And when I met her, she had no bone mass. She had the bone mass of a crayfish. You know, just, there was no bone there at all. And she had a bone mass test, and she came up normal. But how is that possible? Well, people don't know that at the age of 25, you know, to the spine, there's no more blood supply. The only way of nutrients you get to the spine is through motion. You know, and motion is, where's Rebecca? Okay, give me one of the spines.
This one?
Yeah, lower one. That's not important. But the bone mass just improves. Now, people don't understand that our bodies are designed to live to about, okay, our bodies are designed to live about 200 years. Okay, they are. You know, I mean, you look at the biblical words and things, how they live so long. Basically, there's no reason to die because they regenerate. The body regenerates. And I get a lot of patients at the office, and you know, well, I have arthritis. What's arthritis? I mean, they always use it. Wait, where's arthritis? Huh? Not you. What is arthritis? Huh? What? I don't know your name. What is your name?
Gilbert.
Gilbert. What's arthritis?
Deterioration?
Man, nobody really knows. So have you? I don't know. Have you had any problems? Ever been to the doctor said you have arthritis yet?
No.
Yet. He said yet.
Well, it's inevitable. I mean, it's inevitable. I mean, I have so many patients come in here. I mean, we're talking tons of patients. You know, have gone to the doctor and they told them they have arthritis. You know, and they think they're doomed. People believe that like arthritis is a disease. You know, they think it's like AIDS. You know, once you do it, you're dead. You know, but arthritis is nothing more than inflammation of a joint. You know, for instance, this is a joint right here. Need more chair.
Your beat's hard.
Find a chair. Okay, we'll get more. We have more, plenty of chairs. Different types. I want a VIP chair. You know. Haven't missed much. I just started. I mean, if you don't eat it, we're all gonna eat it tomorrow, by the way. One thing that's nice about eating it is it's a lot of fun, because if no one eats it, we can always eat it. Yeah.
There's food over there on the counter.
So anything, basically we're talking about arthritis, okay, and nobody has it. Okay, for instance, I didn't remember your name, it was started with an L, right?
Yes.
Okay. All right, you came in with pain, correct? And that condition is called what? Arthritis.
Oh, really?
Yes.
Didn't know she had arthritis. She didn't know she was doomed.
Huh?
She didn't know she was doomed. Now you told her.
Pardon me?
She didn't know she was doomed. Now you told
Yeah,
her.
yeah, people, see, yeah, they don't know that, it's just arthritis. I mean, people, arthritis, hope it's not that. So anytime you have pain in your joint, you have what? Arthritis. And so you're 10 years old, you fall, you sprain your ankle, you have what? You have pain in your ankle, you have what? That's what it means. Because remember, medical terminology is very definitive. Now they've made it smoke and mirror, but the word arth means joint. And the word itis means inflammation. So arthritis means what? Inflammation of a joint. And to have an itis, you have to have pain. And that's the key. So anytime, so you have pain right here, you have what? You have pain right here, you have what? Right. Okay, so what if you have, with your skin is red, what do you have? An itis, but it's called what? Dermatitis.
Oh, no.
Okay, so, but in the joint, they have ligaments, they have tendons, okay, they have bursa, they have capsules, and it's a joint. So arthritis is like a term for all of them. So you can have bursitis. How many people have heard of that? Is bursitis arthritis? Yeah, it's a joint. So it's a big term word. Okay, synovitis, ever heard of that? It's a joint, so it's a tissue in the joint. It's arthritis. So, they use so many different terms, that it's confusing to people. But most of it's very simple. And this is what I've experienced in 40 years of practice. 98% of conditions are easy. Because the Lord made a really wonderful, wonderful machine. We just forgot, how to use it, take care of it, and when it kind of goes on the blink, how to do it. So Gilbert, you have friends, right? They go to the doctors. You have any friends?
I'm his friend. I'll be your friend.
Okay, your name was?
Lisette.
Huh?
Lisette.
That's it. I got the alphabet.
He skipped
right.
you
Okay.
since you have no friends.
Okay. Okay, so you have patients, you have friends who have pain. But they never know what it means. They don't know what it is, what it is, what it is. And people's first idea of pain, well, get over it. But remember the question I asked, is pain the beginning of the problem or the end of the problem? It's toward the end. So if you're 20 years old, you have pain, you're in deep doo-doo. Okay, you have a condition that's really, really, really going to break down. But you don't know it. So you go to the doctor and says, "Oh, what's wrong, John?" So I have back pain. Well, let's see here. Well, I'll take this, see how this goes away. Okay. Well, went away. But here's the problem. Why do you have pain? Because if you have pain, you have what? Arthritis. Now, to have arthritis, you have to have what? A bad joint. Duh. And what does that mean, a bad joint? It's simple. Think. If your car tires are out of alignment, what does it mean? It is what? Out of alignment. We can't think of the simplicity of that. It's just confusing to people that a joint is out of alignment and it causes pain. But it happens to everyone that you know. So everyone you know who has pain has arthritis. And everyone you know who stands crooked has arthrosis. Okay, what's that now? Another term. Osis means a condition of a joint. So if you look at an x-ray and you see these gnarly little things, calcium deposits, but you have no pain, you have what? Arthrosis. And then if you do too much and it starts to hurt, you move into what?
Arthritis.
Arthritis. But if you don't use it, say you quit all the activities, it moves into arthrosis. That's how it works. So that's why I want to rest and let us see what happens. You know, I don't do that to patients too much, you know. I like them to push it so we see how it reacts. Okay, so that's kind of how the body works. Now, if you go to the medical doctor, they give you medication and hey, I feel good. But where does the medication do? Does the medication know to go to your shoulders? Does it know to go to your knee? No, it doesn't. It goes where?
Nervous system.
Your brain. And it sedates the brain. And not to use, because remember, the area of the body is now communicating to the brain there's a problem. And so you're now just made to disconnect. You know, so the body's talking to you, but you're basically ignoring her. At worst, you're basically, now you're doing activity, I feel great, or I'm wearing these patches on my back, I can now play tennis, yeah, but you're doing what to it?
Get it worse.
Making it worse. And that's the problem. You know, so it's difficult. So my goal here today is to get you to think. Just understand what's going on, why I'm here, what can be done, what do we need to do if you want to have a better life. You know, so many people here, you know, some of you, made to think, but it's hard to describe, water, unless you jump in. You got to jump in. And people are afraid. The majority of people are afraid when you go to any type of new thing is money. What we've done with mostly everyone, basically we don't charge them anything to come in. It's just like, it's, if you go to a doctor and it costs you, $200, and you don't like them, or you don't believe in it, it's hard on you. Yeah, that's a lot of money, so let's forget it. Let's see if I can help you, I'll pay for it. Because it's that important to me, to get your system working. And the beautiful thing about chiropractic, it's so simple. Well, it is after 40 years. Okay, all right. Let me qualify that. It is after 40 years. I've gone through phases of my career. My work. Like the first 10 years, I was like, praying, hoping. That's what you call popping and praying. I hope that works. I hope because you really have no idea what you're doing. You're just kind of taught you like a mechanic. You turn here, it'll come around, but you really don't know. I almost quit once because I was so frustrated because I didn't know if I was actually helping anyone because I had no way of finding out. Now, second 10 years, I become good, decent, and I kind of have an idea, see this and that. But the third decade, you go, wow, this is really good. You're doing things that spook you. But it isn't so much me. It's just that you have more confidence in doing things and see the miracles that can occur. Because I scare myself sometimes. What we do with people. I go, God, how did we do this? But I just have faith that God didn't make a lousy piece of work. And it's really, really so simple. It is so easy that people don't understand. And it's simple like this. Okay. Has anybody here had a shoulder problem?
He does.
Okay, let's think shoulder. Okay.
Yeah, you do. He's a swimmer.
Okay, this is normal, right? This is normal. That's a normal shoulder motion. Okay, pretty normal, And not perfect, I'm older now. I'm close to 70 now. Okay, that's normal. So of course. All right. This is, when I was, this is the second patient I ever had. And I was well schooled. I was what you call a kinesiologist. I was this expert in structural biomechanics. But when you get out of school, trust me, you don't know anything. You know not to harm people. And I did that well because I was scared to death to hurt someone. So a patient came to me and she was like this. I can't move my arm. My second patient, in pain. So I think about it as a kinesiologist, this muscle moves there, this one goes there. So I did a little work and she came back the next day and she goes, oh, I don't feel any improvement. Really? So she comes back the next day and says, oh, God, it hurts more today. See, I was a young doctor. I didn't know that that's how it worked. how it recovers. You know, and so she never came back. You know, I thought I was a lousy doctor, not realizing that she was along the course of healing. So how do you know a person's getting better? You know, from us, you know, it's a totally different philosophy. You know, my job is to restore function. You know, patient's job is to not have pain. And that is my goal too. But if I know if I get function, if I get it back to here, the pain goes away. Because the pain is the brain is saying, hey, don't move it because it hurts. You know, but if I take medication, I feel better. You know, that's what people think. That's kind of how acupuncture works. Acupuncture is not bad. Unfortunately, it doesn't change the structure. I mean, if you walk like this, okay, you know, I have back pain. You know, it's a structural, neurological, you know, condition that your brain is doing. It's protecting you. So you don't do this. You can't extend. You know, so I want to do an acupuncture, and I feel a lot better. You know, what about the structure? But see, you know, it's a short term. They don't think. People don't tend to think. You know, you have to move it back. Now you're gonna not make them brand new. I tell you what, you know, you're gonna make them a heck of a lot better. So let's get into how and why it works. It's so simple. Okay, it's hard to demonstrate on the spot. Okay, and it really is, because what you think of a big joint, you know, like the hip or anything. I mean, how many people do we know have degenerative hip disease? Do we know have hip surgery? I mean, that's ridiculous. It is so easy to detect. Easy to detect. Okay, all you have to do is just put a patient on their back and see if they can open their legs. That's it. That's the test. If they can't open their legs, they got a subluxated hip. Yeah, that's it. Hip joint. By the way, the hip's right here. It's not here. It's here. Okay, not like that. That's the hip. Okay, it comes from here. But you have what we call a misaligned joint. Because what? Like this, it doesn't open. So, you know, I have women go like this, you know. Yeah, this side goes like this, but this one, you know. So what's wrong? Well, it's a subluxated hip, and the body is doing what? Protecting it, so you don't move it. Now you go to the corner medical doctor and go, wow, I have hip pain. Okay, I'll write you a prescription. Doesn't go away unless you do what? You don't get to walk. You don't have to work. You cut back your lifestyle. You know, 80%. Probably the pain will go away. You're not putting more weight bearing on it. But it doesn't fix itself. So okay, so after 8 weeks or 8 months, well, we'll use therapy. That's a great word. I'm not sure even what it means. You know, what they do is they'll put you in a thing and do some exercises. Like what exercise? It has to be specific. I mean, everybody has a combination. Every condition has a combination. It only has 3 numbers. We got 36 numbers on a safe. Only 3 is going to open them. You just can't just wing it around hope it's going to open. You have to be right on it. And so like the hip is what is going here. Well, you X-ray and find out that it's pretty decent. There's still joint space in here. Obviously, there's an injury in it because the body's protecting it. So what do? You got to get in there and move the muscles that allow it to go out. So these muscles in here are going to do what? Cramp and stop it. Okay, and then we're going to do is just, go in there and just open it up, 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 and open it up. And what percent of the time does it work? 90% of the time. Because the body wants it. It's what it's doing. It's trying to protect it. Because most conditions are just reactions to why. But what happens is it gets good to another one. Who has any condition? Other than this spine. Let's get on. I like knees. Knees are interesting. Knees are tough because we continue to walk. If you have an elbow problem, you're not a professional baseball pitcher. You're okay. It's only if I reach real hard, but it's a sign that just something's out of alignment. It's a complex joint.
I'm saying shins.
No, they're easy.
Because he has shins and that's not
Shin splints?
No, we don't know what they're.
I mean, where are the pains at?
Uh-oh.
Where is that point?
Oh, it's on the other side.
Yeah, it's not even a joint.
So what's wrong with you?
But he had.
Isn't that the question we want to ask all? That's why we're here, doctor.
This is the shin. It goes from here, it's called the anterior tibialis, okay? It goes from here, and runs underneath here, and it runs underneath, and it's the bottom part of your arch. It's the bottom part of your arch. So when you run, you move like that, it moves like this, and that's how it moves. So if the foot is bad, okay, it's no longer getting the elasticity, you get more trauma in it. Okay, what sports do you do? You like sports or work, or what do you do?
He does all of it.
Okay.
Yes. I'm gonna answer it because you're thinking too hard. He
Yeah.
runs, he jogs, he
Okay.
swims, he
Yeah,
plays
so
racquetball.
it's a muscle that's not basic, the system is broken. But the good thing is, it's not a joint. It's not a joint. They're easy, because the muscles have tons of blood.
But the foot is, right?
Well, yeah, but here, okay, basically, that's the whole system, it's really not a problem. There's no problems except cancer, AIDS, what else? You know, that's about it. The rest is pretty easy. Because all you have to do is get it moving, and it starts to heal. You know, and that's what people don't understand. It is designed to heal, but no one ever changes it. I mean, I don't know how to say it, but you have to change it. Manually change it. Get in there, you know, and all these muscles have nerve endings in it that's sedated or stimulated. Okay, and then you have the joint. The joint's telling you what to do with it, so you have to move the joint. I mean, if you have a bucket, you know, and you keep pouring water in it, think of that as massage, okay, or think of that as medication. They have some benefits, and they may be really important at the time, okay? But you have to do what? Plug the hole. And that's what chiropractic does. It plugs the hole so the body can heal. Now, we use massaging here, but, you know, our massage therapist, you know, is a sadist.
She is. She's awesome. She's awesome.
Okay, because I trained her to treat it. You know, not to massage it, it's to change it. Just to change the dynamics of it. Because it's designed to work X. And if it doesn't work X, it's not functioning. So the masseuse has to go in there and find out each step where the block is at. You know, because they all just go over. You know, I was watching, you know, I watch, you know, I'm trying to help the masseuse here, you know, sure, what not to do. You know, you watch on TV, they do all this fancy stuff. Crap. I mean, you've got to be on it. You have to have it right on to get that thing to change, because when you treat the muscle, what are you really treating? Anybody know? The brain. You're not treating the muscle. When I treat your joint and I get the joint, I am not treating that joint. I am treating the brain, so it basically rebounds and changes itself to accommodate for the adaptation. Because it's all about adaptation. That's why you stand like this, because it's adapting so it can function. Now, you may have to have some time to change it to go back over, but that's what it requires. Is it painful? No. Is it long-term? Depends on your age. For me, yeah. I mean, I did the stupidest thing known to mankind. You know, I never really had knee problems, but it always kind of bothered me. So I decided, you know, I'm 68 years old, I decided I want to take up tennis. I used to be a really good tennis player, and I want to hit some tennis ball. So I started, I'm going to get back in shape for tennis. This is when I've been able to play a little bit, hit and giggle. So I went out there in the morning, hit against the wall, then I went out at night and hit serves. I bought one of those baskets, you know, you can pop the ball up in one of those baskets. So I got there and I went out there, and after 3 weeks, I was a cripple. Because I couldn't walk. I was like this. You know, but I knew what it was. You know, I knew what it was, and I saw having the girls work on me what it is, because, you know, my quads, you know, if you take a picture of them, they look like Arnold Schwarzenegger. I mean, they're just ripped, you know? I mean, they're sinewy, all that stuff. You know, my calves are ripped. I mean, split, you know, they're great calves, but they don't work. They don't work. They just look good. You know, so I went out there and I couldn't walk. So I finally had the girls start working on me and doing the things of reintroducing the muscles to start functioning again. And I feel pretty good now. Just the other day, the other day they started cracking. So if your joints crack, that means they're moving. It means we can salvage you. Yeah. And when they quit cracking, it just means they're swelling, tight, it needs to go the other way. Health and sickness, between health and this is cracking. You're either going to hell or you're getting out into heaven. It depends on what direction, what you're trying to do. But back to this. This is the good thing about pain. This is a great thing about the body. And it is, you need to understand, this is the first part, is the body is alive. How many people have gone to the doctor and said, wow, you have arthritis. See this right here? You have arthritis. And everybody immediately thinks they're doomed. But the joints are alive. They are alive. And so if you start to adjust them, the chiropractic, just start moving, taking them here, moving the joint. Guess what happens to the brain? It says, hey, it's time to fire up. Let's start getting this thing to work again. So new cells come into the joint. It starts to regenerate. Will you become 18 again? No, but who cares? If you get your body to work and function and do things like that, you don't care. You don't have to do marathons. Because people are so abused about, are marathon runners smart? No. How many die every time there's an event? For what? Their ego. You can do activities for enjoyment. You can activate for ego. Bodybuilding is an ego move. Is it healthy for you? No. Is it fun in your mind? Yeah. You just have to balance it off. I used to play tennis, and then, you drop. Was it good for me? No. Did I have fun? Yeah. Eating is the same thing. I'll wear it, but I like it today. You like it. So the biggest message is the joints. They heal. So if you have pain, what is the brain saying? Help me. And basically we just adjust the joints, no matter what joint it is. This joint, that joint, they all heal. They're alive. So people don't know that. So you go, oh, that's arthritis. Does it get better? I don't know. And they don't know. It's scary. In the old days, I'm dealing with medical doctors. The medical doctors used to do a lot more. Everyone. It's very frustrating going to them now, even though I haven't gone to one in 10 years. Okay, but it's very frustrating to them because I hear it all the time. They go to the doctor, I have this as well. Take this. What did I spend only 5 minutes? You only spend 2 minutes. But that's all the time they need to tell you their story. Really, it is, because when you walk in, they already know. We already know. We just have to, look like we're paying attention. And we're actually saying, I already know, but I'm going to let you talk. Because we know. But we do the examination to get specifics, but even the examination is a concept. If we kind of find out the area, the learning's in the treating room, because that's where you basically really find it, because everyone, changes. When you adjust the joint, it changes every time you see them. You have to look at them every time. Listen, well, let's just hit this one. Well, this move, what about this happen? Well, so the body's always continuously changing, so the muscle changes. But the beauty about all of it, and again, is that it heals. All you have to do is move it. I went to the chiropractor for, right? What do they do?
Put me in the table and it's like,
What you got today was chiropractic. Okay? That is a chiropractor treating you as a chiropractor. That is a chiropractor. We adjust the joints that don't work. Was it surprising? Did it hurt? Oh, we charge more for me. Okay. It's this. By doing the adjustment, you change everything. Because that's why you're here, to help me. So I think I covered everything. Anything else? Was there anything? 20 minutes, 30 minutes is about it, right? All the food? I think I covered it all. Anybody have any questions on about your shin splints? Want me to look at them when we're done?
Yes.
No, I understand what causes. Identify that the shoes I'm wearing are not appropriate to the terrain I'm using them on. So I've identified that that's the deficiency,
But it's still hurting.
because I'm still using the same shoes.
Throw away his shoes.
Let me tell you about my experience with shoes. You never know.
It's true, you think, yeah.
Yeah, you never really know.
Unless you get the little insoles things, or no?
No. Well, here's a problem with insoles. Well, here's the problem with insoles, okay? Everyone, did you get insoles before you had pain or after you had pain, or what's the deal? I don't know.
Well, no, we don't have insoles.
Okay, well, this is what people do. Everyone hears about insoles, right? Okay. Ah, you need insoles, okay. Here's the problem, okay? Everyone gets insole because they have pain on the bottom of their feet. They have different names, it doesn't really matter. Insole, arch supports, orthotics. They're orthotics you can charge for. That's what I like about it. And so, there are, okay. Here's the problem, okay? You have a foot that no longer does what? Works right. Okay? It's no longer functioning, so it's now breaking down and your brain is telling you what? Help me. So what people do is they put a insole into a broken system.
Mm-hmm.
That's the problem with it. You have to fix the system. Then put the insole in, maybe, it all depends. Because mostly, 99% of it because you've lost this. That ability to basically flex or extend. That system is gone. So it becomes rigid. Now, if this becomes rigid, that muscle that comes all along here, the anterior tibialis, now becomes what? Rigid also. So it doesn't get that flow. Flow. So there's no balance between the calf muscles and the front muscles, so it's all out of whack. And that's what occurs. But we don't know. I mean, we could be wrong, but it doesn't really matter. It's just really an idea. These are ideas to go across. So things adapt for a reason. Remember, your legs adapt, and it reaches a point of pain. Okay, now see, if you want to figure it out, so what type of work do you do?
Underwater.
Huh?
Underwater.
What? Mean the big helmet or the scuba or what?
Underwater rescue, helicopter addiction.
Okay. So you train a lot to stay with that. Okay, so you don't actually, you work not all the time.
Every day.
Every day? There's someone you're saving every day?
Yes.
That's amazing, because I had a girl's in here yesterday. She's from up north, and she's training for that, for the police department. She was doing mud search last night.
Ooh, mud search? Look for people in the mud?
Yeah.
Well, she says, I don't know, she says they went underwater, they were looking for a dead body. It was a mannequin. Okay, they were looking for a mannequin.
A dead body in the mud.
And so basically, I think it was a Catalina or something like that. So it was apparently you couldn't see anything at the bottom. So they have a technique where they use a rope and they make a circle and they come up, and he probably knows what we're talking about. Okay, so then you need to be in tip-top shape. So who gauges your tip-top shape?
Your ability to continue.
See, that's, here's the perfect response to that. Okay, just think about it. When do you know you have a bad heart?
Pass out.
When you come bring.
Yeah, when you have a heart attack. So you're basing information based on your knowledge. It's not really smart, because you're basing on what you know and you're experiencing. And so it's limited. Doesn't mean it's not right, it just means that it has limitations. But everything has limitations. I have limitations. Yeah, everyone does. But I have probably more knowledge on your shin splints. But you could be right. But try the shoes. Okay, stuff like that. So anybody have any particular condition or question? Because I love answering questions. Okay, because this is what I do.
What's gout?
Gout is basically the body's inability to utilize crystals.
So people who, because I always assumed there was a conversation with another person that, oh, well, they have gout, they're alcoholic. Is that true?
No. Now, for some reason,
Why is that stuck together?
it just, well, basically it used to be called the disease of the rich.
Of the rich?
Rich, R-I-C-H. Because they would eat such foods that, usually meats, that have the enzyme or the protein in it that the body can't digest.
The lactic acid, is it?
No,
Uric
it's,
acid.
I can't
Uric
remember,
acid?
but it's creatinine or something. I can't remember which one it is. but it's one of the, and it can't do it, so it goes into, the liver can't break it down, and so it goes to certain joints that have an attraction to it, and it ends up inflamed. Quite painful. You know.
And that's
But
that's
the
a
way to
diet?
do this, the way
Yeah.
to handle it is this, okay? You have to basically make your body as pure as possible, because your digestive system is lousy. It just doesn't work. It's under stress. Why it is, we don't know. Okay, so you just have to follow a certain regimen to basically, because they know how to get out of it or stay away from it. You know, but it's hard to, because you know there's so much good food floating around that basically stimulates your brain.
right.
You know, I mean, you don't die from it, but it's, you know, makes life difficult. Yeah. And let's talk about car accidents. That patient have two car accidents. What are those? Well, there's misalignments, but those are sudden. You ever seen them? I mean, if you saw a 10-mile-an-hour in slow-mo, of it occurring up slow in the spinal cord, you throw up. You know, it's that shocking. You know, you would have no idea how much impact that has on it. Because our bodies are not designed for that shearing effect. And once it's torn, once the ligaments have lost its stability, and you get hypermobility in the segments, okay, and if it hurts, it's called what?
Arthritis.
And now if it hurts from the car accident, it's called what? Okay, and after you heal and you feel better, you now have a condition called what? Arthrosis. Because the condition will never be perfect. You've lost, you don't have all the parts anymore. Parts have been destroyed.
And that's 10 miles per hour.
Pardon me?
And that's at 10 miles per hour.
Oh, you would be shocked. It's scary. You know, because the car goes forward, but your head doesn't, and it literally sears it. Now, everyone's different. You know, I mean, I'd probably do better than you would at age 20, but I'm now elder, and you know, and I have more degenerative conditions in my neck. I would scare anybody to see my x-rays. I wouldn't even show it to my staff. They may quit thinking I may drop dead any moment.
I got a question. You brought up a good point that we teach is on the example for the car wreck, people tense up. But when they loosen, like as an alcohol or drunk, they tend to survive better and get less injury.
Yeah.
Can you explain the reason?
I knew the reason once, and I'll do the best I can, okay? They usually don't have seatbelts on. Kind of interesting. Okay. They're relaxed. I mean, they do die, but they're relaxed. And one of the reasons is they don't slow down. So if you watch a football player, you know, hit someone mass times speed, they're the hittee, so they're basically going to go someone that way. They don't go that way. Because a person's going to get hit, they will stop. And a person who's not going to get hit and is drunk, they just smash right through. Basically, that's the only logic I've ever heard.
Does it kind of be like your nervous system already goes into your panic
No,
mode?
no,
and you
it's just
tense up?
mass times speed.
Oh, 'cause you're the
create
driver.
more-
You're
You
hitting.
create more mass than they do because they stop.
Okay.
Inertia.
Mm-hmm.
And so you can go right through them, and they'll take the bigger the run.
Because they're the, okay.
It's a concept. I'm sure there's so many variables, but that's the one that makes the most sense. That's why they survive. Because they don't slow down. I mean, if you two people are running, you know, and one throws a stationer, you know, and he runs you over. I mean, it's standing still playing football. You play football, you know, the person who's basically not moving is the one hurt. Because, you know, you're basically dispersing energy and mass. You know, that's kind of how it works. Nice subject. Nice subject. Any other questions? Cool. Thank you all for coming. I enjoyed doing this. I think it's next week's Spanish week. Next week's Spanish? Third weekend of the... We have Spanish week, but I can't do this for us all. But I could do this for people. If you speak Spanish, you're welcome to come. I don't speak Spanish. You know, I'm classic pocho. You know. Huh?
Yes, you do speak Spanish, that's a lot.
Yo sé mucho, I do not speak Spanish. I know enough Spanish, okay. I know enough Spanish. You know, remember, I was born in 1946. Okay, back then, there were no Mexicans in the United States. There weren't any. I mean, we had a small segment in Canoga Park, where I was raised, okay, you know, but I was in the white section of Canoga. I wasn't even the Mexican, you know, the menudo, you know, band. You know. And then they had East LA, Pacoima had a few, remember, you know, La Bamba, San Fernando? They had a few there, but there weren't any. It wasn't until in the, was it 60s or 70s that Mayor Yorty and then passed a law that you no longer ask anybody for their ID card or whatever. That's when it started. Up to that point, I mean, remember, it's Los Angeles was just a little small thing. It was mostly Indians. You know, Indians are the ones that have. I mean, look all the people that were there now, you know, making rich off gambling. They are the ones who were here, not Mexicans. You know, I mean, Spain, I mean, Mexico claimed it, but what do they have, you know, 40 soldiers? They weren't anyone here. You know, that's why it's so easy to take it over. They're there and here. Well, we want to fight with what, 40 people? You know. Anyway, here's a trivia question just to let you go. What is the official name of Los Angeles?
Los Angelinos.
That's the people in it.
There is an official name. I think there's some question on it now, but you know, it's the Queen of Angels, Los Angeles, the Queen of Angels.
Queen of Angels.
Queen of Angels. Okay. Here's the trick question. Porsu Uncula. It's an Indian name. First, it means many rivers.
We had a lot of rivers in that.
Yeah, because in here, remember, when I was a kid, there's all sorts of little creeks all over the place. You know, they weren't, remember the LA, everyone drowns here. I mean, I was a kid, I mean, you know, they were drowning all the time there. You know, people would play by the river and hey, those rivers were deadly. The water come down. That's your trivia question for me. I love worthless trivia. Anyway, anyone know what cops mean?
With what?
Cops. He's a cop. What does it mean? COP. What is a cop? Yeah, what does it mean?
Is a citizen on patrol?
You're close. Constable.
Constable.
Constable. It's from back east.
I cheated, he
Yeah,
said
Boston.
it.
Yes, Boston.
But you don't want to say it.
It's from Boston. Okay. And what was the word in the? No, this is my favorite. I can't remember now. The
You
day
do
that
crossword puzzles?
No, I don't have time. You know, but I used to, what's that game he used to play? There was a trivia pursuit.
Yeah.
I used to be good at that one. That was pretty good. I mean, I have no idea why I know. I remember. I just, it has no value. Trust me, you know, none whatsoever. Okay. So I think we're all done. Okay, I'm gonna get to eat now. I think. And maybe one day the video will work. Well, you know, we have this. I don't know if I actually even put it on because I think better without it. I have more fun without it.
Okay, it's okay.
I don't know.
It's great.
You haven't seen me do this before?
Never.
Really?
This is why I was wanting to come, but.
While we're here.